How can you get pregnant faster this month? In this video, we are going to discuss the question, how can you get pregnant faster this month? And we are going to pay close attention to the ovaries. We are going to look at the ovaries, how you can get pregnant faster this month, and we are looking at your ovaries. Osobola otya okubanga ofuna olubuto amangu? Mu channel yaffe eno leero, mu musomo gwaffe gwa leero tugenda kwogera ku butya bw'osobola okubanga ofuna olubuto amangu, naye tugenda kwetegereza nnyo amajigo. We are going to pay close attention to the ovaries. The ovary is that part which actually stores those small eggs which go on and become fertilized and then become babies, or they become embryos. So when we are looking at how you can get pregnant faster, it is very important that you understand how this whole process takes place, how this whole process of fertilization or ovaries take place in helping in the development of the egg cells. So without further ado, we are going to talk about all this. When we take a closer look at the ovaries, you realize that it is divided into many parts. Bw'oba weetegereza ejjirino oba lye bayita ovary, ojja kulaba nti lirimu obuntu bwe bayita bu follicles, buli oval oba bwa round. Obuntu obwo bwe buvaayo ne buba nga ate bukula ne bufuuka eggi eddene erikuze oba eriri mature. We've said that when you take a look at the ovary, it has different parts. But first of all, we shall understand that these parts play a very key role. The first thing is that it has what we call the medulla. The ovary has a part known as the medulla. When we take a look at this diagram, that part which is actually supplied with blood vessels, the part which is actually supplied with blood vessels and also muscular and connective tissue, that is what we call the medulla. And then the cortex is that part which contains the follicles. Tugambye nti eggi ery'omukyala lirina parts bbiri ez'amaanyi, era tugambye nti part esooka yeno gye bayita medulla, ate ne tugamba nti part endala ey'okubiri yeno gye tuyita cortex. Medulla yeyo part erimu ebinyamanyama oba ebikwata eggi eryo kubanga liri wamu, and then tugambye nti cortex yeyo part erimu amagi mwe gakulira ne gaba nga ate gasobola okuba nga gabeera fertilized. Welcome to our channel, Gerald Massa, the health educator. And on this channel, we do create awareness about fertility and reproductive health and ultrasound scan, and we help you understand the whole process of how you can get pregnant faster naturally. And even if you are looking at getting pregnant through assisted reproduction techniques, then still this channel is for you. Watch our videos. I believe you'll get what you'll get the lesson which will be very important for you in your journey of getting pregnant faster. We've said that the ovary is richly supplied by actually the follicles, and these follicles grow from a very early stage. They grow from a very early stage. The early stage of the follicles is what we call the primordial follicles, and then they go on and become what we call the primary follicles. They go on up to secondary, and then they mature to become what we call the mature Graafian follicle. Tugambye nti eggi bwe liba litandise okubanga likula, litandikira ku ka point oba litandika ng'obugi obutini bwe bayita bu primordial follicles, naye ate ligenda ne likula ne liba nga ate lifuuka primary follicle, ne ligenda mu secondary follicle, then from there ne lifuukira ddala eggi eddene oba erikuze obulungi lye tuyita mature Graafian follicle. The mature Graafian follicle is always released on the 14th day, and when it has been released, it actually hangs around that ampulla part of your fallopian tube where it is fertilized and then becomes actually a fertilized egg. It goes on and then it forms what we call a blastocyst, and this moves on up to your womb and then it attaches onto your womb. Tugambye nti eggi lino likula ne liyita mu stages, okuva ku stage gye tuyita primordial follicle ne ligenda ku secondary stage, ne ligenda ku tertiary stage, oba ne liba nga lifuuka kye tuyita mature Graafian follicle. bwe liba likuze ne liba nga lituuse ku stage gye tuyita mature graphic follicle, liba lisobola okuba nga lyekwata ku kisenge ky'abaana ne likula ne liba nga ate libadde fertilized bulungi. So in today's lesson we've said that you can get pregnant faster. The key is that you need to understand how your ovaries do function, and then having understood how they do function, and then you'll be able to actually do what we call timed intercourse or undergo ovulation. Gerald Massa, the health educator, is the name of the channel, and remember, we've given you the tips of how you can get pregnant faster. We've said that the first key thing you need to do is you should monitor your ovulation, and then the next thing is you should look at your diet. A diet that is rich in green leafy vegetables is very important, and then we've said that you should reduce on ever exercising if you are looking at getting pregnant faster. Do away or stay away from fortified processed foods because they are high in xenoestrogens or those types of chemicals which are really not good for you. And then lastly, we've said that you can get pregnant faster by at least keeping away from family planning pills, because if you are looking at getting pregnant faster and you are on family planning pills, then it may not be so good. Tugambye nti osobola okufuna olubuto kasita oba nga at least okoze bino ebintu bye twogerako. Olina okuba nga at least olya nnyo emmere oba ebivavava bino ebya greens, and then n'ekirala olina okulya emmere endala yonna, naye weewale emmere eri processed oba gye bapakinze gye batunda mu maduuka. Gezako okulaba nga ogula emmere eno mu katale gyeri organic foods are very good. Obeere ng'ogyetegekera lumonde mulungi, ebintu nga amagi birungi, ebinyeebwa birungi, oba tolina buzibu bwonna bwonna n'eyo emmere. Gezaako okulaba ng'olya nnyo emmere eri organic. Tugambye nti ate weewale okuba nga okozesa family planning, kuba ate esobola okuba nga ereeta kye bayita hormonal imbalances ne ziba nga tezibalansinga, ate n'ekirala okuba nga osobola n'okuba nga ate ofunamu n'ebizimba. So we've said that you can get pregnant faster. You need to follow these tips. I welcome you to our channel. If it's your first time on our channel, my names are Gerald Massa, the health educator, and we do create awareness about fertility and reproductive health on this channel, and also help you get pregnant faster by giving you the right information. This video is for education and information purposes only. See you in my next video, and have yourself a fantastic and healthy day. May God bless us all. What are uterine disorders? What are the different types of uterus? In this video today, we are going to answer a question: what are uterine disorders and what are the different types of uterine disorders? Gerald Massa, the health educator, is the name of the channel. I welcome you, my friend, for today's lesson, and today we are going to talk about uterine disorders, the different types of uterus. Mu video yaffe ya leero tugenda kwogera ku biki oba bika bimeka ebiriwo ebyannabaana, ate biki oba ndwadde ki ezisobola okuba nga zirumba n'abaana. Channel yaffe eno nkwaniriza mukwano gwaffe weluba nga lunaku lwo olusooka, nyiga epeesa erya red osubscribinge obeere nga olaba videos buli kanaku zetufulumya nga ate ziba zikwata ku ndwadde ez'ekikyala. We are talking about the different types of uterine disorders. Before we proceed, we need to take this home. We need to take this point that the uterus or the womb is where the baby grows. The uterus is that part of the woman where the baby grows. But in most cases, there are times when it will be affected by some conditions. Tugambye nti mu video yaffe tuli kwogerako n'abaana, tugambye nti n'abaana yeyo part omwana mwakulira okumala ebbanga ery'omwezi omwenda. When we are looking at the uterine disorders, or when we are to identify what actually are the signs of uterine disorders, the first sign to show that you could be having an issue or you could be having a problem with your uterus is that you are going to experience bleeding. You are going to experience bleeding either during sex or after sex, and then even without even like having sex or playing sex, you may begin experiencing bleeding, and then your periods may change. If at all you are a woman and your periods have changed of recent, and then even when you have been with your partner after sex, you experience bleeding, then that is a warning sign. It is among the first signs to show that you could be having a uterine disorder or you could be having a problem with your womb. Tugambye nti sign esooka okumanya nti wandibanga olina obuzibu munabaana oba ogenda kulaba omusaayi nga gufuluma. Omusaayi guno gusobola okufuluma nga obadde ne bbaawo mu kikola ekyokwegaata oba ne woba obadde tobadde mu kikola kyakwegaata ogenda okulaba nga omusaayi guno gufuluma. Ate n'ekirala ogenda okulaba nti ne periods zo zimala ne zibanga ate zitandika okubecominga irregular oba ne zikyukakyuka. We are talking about uterine disorders, the different types of uterus. So we have said that when we are looking at the uterus, there are three specific types of uterine disorders. The first disorder or the first abnormality of the uterus is what we call a septate uterus. Septate uterus is our first type. Tugambye nti ekika ekyanabaana eri abnormal oba etatukiridde gye tuli okwogerako yeno gye tuyita septate uterus. Septate uterus. And then the second type is what we call the biconjugate uterus. The second type is what we call a biconjugate uterus. Remember, we are talking about uterine disorders, the abnormalities of the uterus. We are going to expound more on this, but we are first of all elaborating them. And we have said that the first type of uterine disorder is what we call a septate uterus. The next type is what we call the biconjugate uterus. And then lastly, we have what we call a didelphys uterus or didelphys uterus. Tugambye nti mulimu ebika bisatu ebyanabaana kasiteba nga ebadde erina obuzibu. Ekika ekisooka kye kino kye tuyita septate uterus, and then ekika ekyokubiri kye tuyita biconjugate uterus, then ekika ekyokusatu kino kye tuyita didelphys. So there are three key uterine abnormalities, although there are others like the uniconjugate and then of course also others like the simplex, but the three major ones in women, the three major abnormalities in women is what we call a septate, a didelphys, and then also a biconjugate. So we have said that a septate uterus appears as if it is normal. When you take a look at it, it appears as if it is normal. But when we take a closer look at the endometrium, when we take a closer look at the inside of the uterus, normally there's incomplete fusion or there's incomplete joining. The endometrium is divided into two, but on the outside look, the uterus appears as if it is normal. We have said that with a septate uterus, on the outside it appears as if it is normal, but inside there's that thin line which is known as the endometrium. It is actually divided. That is the first uterine abnormality. Why are we talking about uterine abnormalities? We are talking about uterine abnormalities to create awareness so that women or couples who have been having recurrent miscarriages may understand why you have been having repeated miscarriages. You could be having a uterine abnormality. You could be having any of these abnormalities we are talking about in our lesson for today. Remember, on this channel, we do create awareness about fertility and reproductive health and ultrasound scanning. So if you have any questions in regards to fertility, reproductive health and ultrasound scanning, then this channel is for you. You are most welcome to our channel. Tugambye nti ekika ekisooka ekyanabaana erina obuzibu kye kino kye tuyita septate uterus. Septate uterus. Ngenda biteeka wano obeere nga obiraba spelling yazo, obeere nga weeyongera okunoonyerezaako. Wandibanga obadde ozze ovaamu embuto kye tuyita repeated miscarriages, naye nga ate maybe nabaanayo tetukiridde, nabaana yandibanga erina obuzibu. Tugambye nti mulimu ebika bisatu ebyanabaana erina obuzibu. Ekika ekisooka kye kino kye tuyita septate uterus, ekyokubiri kye tuyita biconjugate uterus, then ekyokusatu ekisooka ye septate, ekyokubiri kye tuyita biconjugate uterus, and then ekyokusatu kye tuyita uterine didelphys. So we have said that in a septate uterus, there's incomplete fusion of the endometrium. Remember, all these are abnormalities of the Mullerian ducts. For the medical professionals watching this video, the Mullerian ducts specifically are supposed to fuse completely, but if they do not fuse, then we end up with these uterine disorders. So, to simplify everything, the first type of uterine disorder is what we call a septate, and by now you know what we mean by a septate uterus. This is when on the outside the uterus appears as if it is normal, whereas on the inside the endometrium does not fuse, does not join completely. And then the next type of uterine disorder, is what we call a biconjugate uterus. Biconjugate uterus is a uterine abnormality. It's a uterine disorder whereby the uterus does not fuse completely. When we take a look at, let's take an example that this was the fundal part of the uterus, this is the upper part of the uterus, and then down this way, this is the cervix. It does not fuse, it actually bees like this. Biconjugate is basically, actually you be as if you have two uterine horns. The upper part of the uterus is supposed to be single, it's supposed to be one, and then it's supposed to be in an anteverted position, but it divides, it does not join completely, and then down this way around the cervix, it joins. So by now, I think you know what we mean by a biconjugate uterus. Tugambye nti mu ekika ekyanabaana ekyetuyita biconjugate uterus oba ekirwadde ekyanabaana kyetuyita biconjugate uterus, nabaana eno waggulu erina okuba nga eryemu yokka, naye ate ogenda okulaba nga eno waggulu tejoining, esigala eri open, and then wano ku mumwa gw'anabaana wejoiningira. There are two endometrial stripes inside, there are two fundal heads, and then down they share, at the inferior part they share the same cervical part. We shall take an example of this. Specifically, a normal uterus is supposed to be like that, but with an endometrium. But in biconjugate uterus, it divides into two. There's division, there's incomplete joining of the uterine head. So that is the second type of uterine disorder. We are going to go to our third type of uterine disorder, and this is what we call the uterine didelphys. Uterine didelphys. Tugambye nti ekika ekyokusatu ekyanabaana etatuukiridde erina obuzibu kyekino kye tuyita uterine didelphys. Tugambye nti we've said that the uterine didelphys, it is an abnormality, it is a disorder of the uterus whereby there are two uteri. There are two uteruses. Actually, a woman who has two uteruses, two wombs, that is what we call a uterine didelphys. It's an abnormality whereby you cannot get pregnant. You get pregnant, the pregnancy ends up into a miscarriage. You remember, we've talked about miscarriages in our previous videos, and we have said that this is pregnancy loss before the pregnancy makes it to 20 weeks. So if you are a couple and you have been trying to get pregnant, whatever pregnancy you get ends up into a miscarriage, you are experiencing heavy bleeding, you've done the routine testing for cancer of the cervix, it is normal, you've done the urine analysis tests, they are normal, you've done the RPR tests for syphilis, treponema, they are normal, all the tests you're doing are normal, but you are not able to get pregnant. It is high time you thought about doing further tests. It's high time you did a pelvic ultrasound scan. How can you identify that you could be having uterine disorders or you could be having a uterine abnormality? It is very simple. I've just mentioned it. You specifically have to do what we call a pelvic ultrasound scan. A pelvic ultrasound scan gives clear pictures of how your womb is. Ideally, a normal womb, a normal uterus is supposed to have 3 layers. The outer layer is what we call the perimetria, and then the inner layer is what we call the myometria, and then the innermost layer is what we call the endometria. It is supposed to have a cervix, and the cervix is supposed to be free from growths, it's supposed to be free from fluid, and then a normal womb is supposed to have open or patent fallopian tubes. And lastly, a normal uterus or a normal reproductive system in a woman is supposed to have 2 ovaries which actually ovulate, which are functional. Dysfunction of the ovaries, blockage of the tubes, and disease of the womb may end up causing issues or difficulties in getting pregnant. Tugambye nti ebika ebisatu ebyannabaana bye bino bitogeddeko era by now kusaawa eno ndoza at least ebika ebisatu ebyannabaana ebitera okuleetera embuto okuvaamu obitegedde bulungi. Ekika ekisooka kye tuyita septate uterus, ekyokubiri kye tuyita biconnuate uterus, and then ekyokusatu kye tuyita uterine didelphys whereby omukyala abeera n'abaana 2. Remember, you can talk with me, you can consult me if you have any questions in regards to what we've talked about. Talk to me. You can book your appointment. All my clients are booking, and remember, you can book and then you can consult me. You can have a one-on-one consultation with me on my WhatsApp number. My number is +256 701 7978 76. Booking, if you are outside Uganda, it is $10 only, and then if you are within Uganda, it is only 30,000 Uganda shillings. So if you are within Uganda, you can still do your booking, and then I will answer all your questions. I will give you my best recommendations on how you can get pregnant faster, on how you can address all your questions you've been having about fertility. Osobola okubookinga okwogera nange ku WhatsApp namba yange woba oli mu Uganda. Consultation fee abalwadde bange bonna abali okuneebuzaako bali kusasula consultation fee ey'emitwalo 3 gyokka, ogisasula through Airtel Money, and then when oba oli wabweru wa Uganda ziba $10 zokka, era osobola oziweereza through my Airtel number eno gye ntadde wano 0701 797876, oteekako code eya +256. Tujja kuba tuwayamuko nkuwe information eri very important okumanya nti ejja kuyamba obeere nga at least osobola okubanga ovunula ebibuuzo byonna byobadde olina mu ngeri gy'osobola okubanga ofuna olubuto amangu. I'm looking forward to talking with you, my friend, and remember, come back tomorrow. There's a new video more about fertility, about reproductive health, about ultrasound scanning. Ask me all your questions and I will answer all your questions. Have yourself a fantastic and healthy day. Thank you for subscribing. Thank you for watching today's video. Bye bye. Omukama atukume fena era komawo enkya obeere ng'olaba video zaffe olunaku olungi. Bye bye.